Good morning, my name is Daniela Coimbra, and firstly I would like to thank the invitation to be here. Muchas gracias. I am a lecturer at the Superior School of Music and Performing Arts at the Porto Polytechnic Institute, and my background, this is a specialized music school in training performers, not only musicians, also actors, and then musicians, composers, and conductors. My background is in psychology of music and music education, and in my research area we address two main questions. What are the mental and the physical requirements necessary to perform, and also how can we enhance musical performance? These two questions will underlie my presentation. So what do we know musicians do when preparing a musical performance? This is something really very difficult. They need to process very complex music information. They need to gain and to acquire and to develop instrumental or vocal control. They need to coordinate and they need to synchronize with fellow performers, and they need to do all of this within an interpretative insight and innovation, even if the repertoire they play is 300 years old. They need to be able to perform in public, and they need to understand the audience's expectations. The question is, how do they acquire these skills? And we know from Sloboda studies and many others that the first thing musicians do is a great deal of practice. In this study from 1993, we know that the students from the Chitham's Music School, by the end of their secondary school, they had gained 10,000 years of formal study in the instrument. We have to add all the informal study they do. We also know that musicians have it's a job with a great isolation. They face the practice room isolation, the frequent traveling, the consequent family isolation, and perhaps the most difficult isolation of all, the reluctance in sharing problems in what is a very, very competitive job. They also need to learn how to deal with the fight-flight emergency reaction. They need to know how to deal with stage fright, which is always present. And this is present from very early stages. We have carried out a study at the Guildhall School of Music and Drama, and we found that in the mid-year examinations, 100 of the students felt really anxious before the exam, and this is normal to be anxious before a public performance. The problem is that 55% of these students felt that anxiety negatively affected their performance. Also, musicians need to face everyone nowadays has this problem, I guess, but musicians, they face financial pressure, and usually in their portfolio of activities they contain performing, teaching, recording and freelancing, and many times at the same time. So on a study, there is a lot of research on the physical constraints musicians face, and we have highlighted this study by James done in 1997, and the reason we highlighted this study is because 83 of the students felt that training did not prepare them for the physical and psychological stressors of their job. This is where we enter in our school. However, because we do a lot of work in our school, we got, well, I'll go to this in a while, sorry. So, coming back to the physical constraints, there is something I would like to point out. Most musicians complain about neck pain. Also, orofacial pain. This is something that is a little less discussed, perhaps. And also the pain that derives from transporting the instrument, not only from playing the instrument. So coming back to our project, when we talk about all this research in Porto, we got to the Fundação Casa da Música. This is a foundation which has many resident groups, among which one symphonic orchestra. And this orchestra has 94 elements. It's called Orquestra Sinfónica do Porto Casa da Música. The manager of this orchestra, Andrew Bennett, to whom I always thank in these presentations, called us. He was the one who called us, and he said, I have 3 problems. I need to identify the specific problems the musicians of my orchestra have. I need to discuss strategies, and I need to implement solutions. We were very scared with this because Mr. Andrew Bennett had a lot of research specifically on the physical constraints of the job. He was very worried, and he wanted us to address mainly the musculoskeletal problems of the musicians. So we need to set the ground with him, and we sat together. We looked at all the research he had, and we discussed some very important matters with him, because we cannot make some false promises. We cannot promise the world to an orchestra and say that we are going to solve their problems, all their problems. So the repetitive movements musicians do is not a controllable factor. They will always be doing repetitive movements. Their type of diet, sleep and tobacco is controllable. Any previous physical trauma is not controllable. The fact that they have to practice and that they have to work every day is not controllable. Although according to this manager and many others, the fact that they also play besides the orchestra could be more controllable. This raises many questions and many labor questions, which are a bit out of this presentation, but I thought I should highlight this point. The repertoire the musicians in these orchestras play is not controllable. They don't choose the repertoire, they don't have a voice in choosing the type of repertoire. Their technique and posture is partially controllable. We have seen now that it's partially controllable. Their stress management is controllable. Their age is not controllable. Their gender is not controllable. The environmental or work conditions they face is partially controllable. The musical instrument they play is not controllable, and the lack of prevention is controllable. So we need to act on what is controllable or partially controllable. So we started this project by doing some interviews to the representatives of the orchestra sections, and much to our surprise, what the musicians were most worried about were not the physical constraints, but the hearing problems. So they were very afraid of losing their hearing. This was followed by the musculoskeletal problems, as the manager has identified, especially joint, back, neck and shoulder pain, bruxism, which is the clenching of the jaw and the teeth, and anxiety. So we decided to act upon 3 fronts, and we contacted the Polytechnic Institute, the Superior School of Health Technology. They have a department which does environmental health and audiology research. When they came to Casa da Música, they told us, oh, hearing problems are multifactorial, isn't it everything? So we cannot solve the problem just like that. This takes time, and we need to see the degree of exposure of each musician, the type of and duration of exposure, the peak of the exposures, the placing in the orchestra, and also the repertoire they play. So they also told us that there is a great need to raise awareness on this matter. So we decided to translate with this institute the book A Sound Ear by Alison Wright Reed, and we translated it to Portuguese. We offered to all the musicians, and it is freely available on the Fundação Casa da Música website. We then invited Alison Wright Reed herself to do a seminar presenting and a book launch, and we invited to this launch managers, musicians, teachers and researchers. So we then Casa da Música has its own acousticians, and they have an acousticians team. So we asked the acousticians if they could incorporate the researchers from the audiology department. They said yes, and the first thing they do was to assess whether there was an adequate insulation of rehearsal and practice rooms of Casa da Música, and they still do some work on that. We then prepared many seminars and discussions on individual hearing protection. This was the most desirable and the most attended seminar, and also on some stage protection, namely the use and the type of sound barriers. We did a protocol with the school, and we were able to implement complete hearing tests specific for musicians, and then we could also offer, until now, subsequent medical referral for free. So now let's pass to the musculoskeletal problems. So we contacted the Institute of Biomedical Sciences and their Department of Immunophysiopharmacology. And the manager of this orchestra had a very specific question. He said to these physiotherapists and osteopaths and doctors, he said, I would like to know, I want to map out the pain in my orchestra. I want to know if you are a flute player, where does it hurt? So we decided to set a research project, and the aim of the research project was to compare the intensity and the prevalence of playing-related musculoskeletal disorders into professional orchestra musicians playing string and wind instruments. These were the two groups that we started with. The inclusion criteria for this study was a diagnostic of playing-related injury by a physiotherapist at that moment. So something very nice happened here that I would like to share with you. That is, Porto is not a very big city, and the Orchestra Sinfónica is quite well known locally. So some other orchestras asked us if they could also take part in this study. And we were able to say yes. We work in universities, we have a limited budget, but we could say yes. And so in this study, we included musicians from 3 orchestras. And in the end, we had a total of 112 musicians. So their main complaints, this was the answer we had to give to the 3 managers of the orchestra. Flute players complained a lot of their left shoulder and cervical pain, clarinet and oboes about their right thumb, and trombone players lower back pain. If you are a violinist in this orchestra, you have it all: left shoulder, right shoulder, cervical pain and lower back pain. Viola players, cervical pain, and cello, cervical pain and lower back pain. As a result of this, we started some discussions with this team, because some new problem for research arose, that we also had some people from the sports department, and no one agrees until today on the type and adequacy of the warming up and stretching exercises. There is great controversy on this matter, and this is subject to research at the moment. But, however, the physiotherapist was able to devise some specific exercises to treat lower back pain, cervical pain, and shoulder pain. Then we had something, again, that just happened by chance, and sometimes you have to be open to these things, I guess. And the dental school of the University of Porto saw a conference where these results were reported, and they said, we would like to go to Casa da Música, we have something to show you. So they came to Casa da Música and they did a seminar on orofacial problems of musicians, particularly wind instrumentalists. So after that seminar, all the musicians wanted to go to that dentist. And so we were able to do a protocol with the dental school, and we were able to offer to 20 musicians of Orquestra Sinfónica do Porto who voluntarily wanted to work with the dentist. We did some panoramic x-rays, dental examination and dental casts. This is very expensive. We had the help of Pierre Fabre and Bial, especially because after that, and because Porto is not such a big city, the army, which has a military band, wanted to participate. They said, we also have problems with our musicians and we want to take part in that. Are you able to help us? We were, so far. And so they entered the study, and also a philharmonic band. They have a lot of wind instrumentalists. So by the end of 1 year, the dentists came back to us and they told us that there are 3 main problems with the musicians they have seen. Muscular hyperactivity, more specifically in the wind instrumentalists, and problems that arise from the biomechanical of the temporomandibular joint, especially the bassoon and oboes with the retraction of the mandible and the violinists with the lateralization of the mandible. They also reported, as we were expected, some posture problems that arise from the repetitive movements, and they were able so far to offer treatment for musicians, specifically for musicians, for free. So the results of these 7 years led us to also organize 5 small meetings in different schools and venues of the country, so we could start raise awareness. We were present in many conferences, all the researchers were present in many conferences, and we were able to do some publications to also raise awareness and to discuss results. And we were able to devise some strategies and provide some treatment. So we find now at this stage where we are that we were able to open some doors. Also, the possibility to discuss the physical problems has a very significant positive psychological impact. And now we are able also to look at some of the psychological issues that managers are so afraid of. And also, we were able to build a network within the city, and all these 5 institutions are, 5 plus Casa da Música, so the 6 institutions are now able to work together, and we have a network established, and this is very positive. However, we are teachers in universities, and none of us works completely to this project, and so we feel now that, and also we cannot go on provide free treatment for all the musicians of the country that asks us. We would like to, but we cannot. So we now find that we really need to have a centralized action, and we need a way to centralize all the information on prevention, treatment, on the musicians' problems with the managers and also with the researchers. This is what we would like to do, because only then could we, only by doing so, new challenges in solving problems on a musical context may occur. It is possible to optimize musicians' health, well-being and training, and also hopefully to make a significant contribution to musical life. Thank you very much indeed.